it gradual. Don't you want to hear like that all the time?
Wow.
Yeah. But it'd be nice if you could.
It would be nice if I could hear.
If you could understand people. Yep. Didn't have to ask them
a million
constantly
times.
what they're saying.
And even on the phone, I'm like, what did you say? Say that again.
Yep. So this is going to help on the phone as well. Okay. Now we have a couple of decisions to make to get you hearing better. Okay. One is what it looks like. Okay, so the ones you have on go over the ear. Let me just show you what they look like here. Can't see them a lot at all. You're not going to see them at all if you always have your hair down.
I usually wear my hair about this way.
Okay, so let me just show you. So you've got a wire here and a small piece that goes down in the ear. Okay, you don't see much, and then with your hair, you're not going to see it anyway. Okay, we do have other styles that just go in the ear.
That's what I was looking for.
Okay. Yep.
They're probably more expensive.
They're not.
Oh,
they're not. So when we talk about cost, doesn't matter what it looks like. Okay. So is that something, one that's just down in the ear? Is that something that you think you would be more comfortable with rather than the piece behind your ear?
I think so. Simply because I might
with your hair and
something, or forget it's in my hair and comb it out, you know, break it or something. Yeah. That's what I'm concerned about.
So what we would do.
Very absolutely. Yeah. And plus, when I wear my glasses, I don't want
putting them on and off. No. All right. So
trying to get more active, though.
Yeah, absolutely.
I want to because I'm joining the gym.
Good. Good
next
for you.
Week.
Good for you. I just started working out again this weekend, and I'm like, I'm so sore.
That's what I'm not.
I gotta get back into it though.
I'm already.
I feel the same way. I've been dancing my whole life.
Oh, you just wait, yeah.
You ain't lying.
So, all right. So you're
on this stuff to me.
Yeah, absolutely.
To everything.
Yeah.
At one time.
Yep. Yeah, and that's why we do exactly how much worse it's going to be, and with the understanding is what we worry about. Yeah. Now the other thing.
Any lower than 60?
Yeah. The other thing would be to go down.
18 months. What is that? 2 years.
We go down to. We stretch it out for 60 months. That gives you the lowest. 5 years.
5 years.
But you can always pay more. You know it.
That sounds better.
Okay.
For the bathroom?
We do, yes. If you go out to the front desk, there's a key where you checked in.
Can I take this?
Oh, yeah. Just go ahead and pull them out. And if you go out the doors to the elevators, make a right. It's the first door on the left.
Okay.
Yeah, it does get a little itchy. And it may or may not, but we've had stranger things happen. The only other thing that we need for this one to check your credit is your monthly. Okay. Well, I have to. Oh no, you know what? I can do this one here as well. Get you out of here.
What does she want?
She wanted to tell me my credit card.
All right. This takes about 5 minutes to harden. We're going to put this first piece of foam in your ear, and then we're going to put this 2-part silicone material in. Feels really cold and gushy. It's kind of a very strange feeling. But just takes a couple minutes. When we put this in, you are not going to hear anything. It makes really good earplugs. So you are not going to hear anything. And then we take everything out, and that's what they'll make the hearing aids off of. foam in first. We just got to go down pretty deep because we want the hearing aids to go down as deep as we can. Yep. Is that all right? Oh, that's okay. Good. Take that out. I don't want that one. Let me get a different one here. I'm just going to get a cotton one just with the shape of your ear.
I got some little holes down deep in my ear. My ears go
They
down
get,
just a
yep,
little
get
small.
tiny.
My
Yep.
ears are big, but the inside is small.
Yep.
No, she's
Okay.
yeah. I just want to touch it.
Let's try this one. See if this gets a little bit better. There we go. Okay, and turn around this way. We'll go ahead and do the other side.
Never in my million years thought I'd have to wear a hearing
I
aid.
know.
Yeah.
And how much better things can sound.
Yeah. Maybe I can read it.
Yeah, absolutely. Can help with all the concentration. We had to turn this way
I
a
thought
little
it
bit
was
more.
the depression.
Right.
My depression.
Which can
causing my
certainly affect that as well. But you would be surprised is when you have a hearing loss, there's a much higher risk of depression and anxiety.
Yeah.
When you're not hearing things the way that you can, also causes a lot of that.
Wow. In 08.
Okay.
And then I had to want to early retirement because I got so sick behind losing my job.
Yeah.
I couldn't go back to work.
Yeah. Oh, absolutely.
Breakdown. Good Lord.
Yeah. That again is one of those things that just it affects everything. All right, we're going to plug you up here. You are not going to be able to hear anything. I won't let her talk about you.
She will anyway.
So this is cold and gooey, and it's a very strange feeling. Plug y'all up here. Yes, it is. You're not pushing up on your ear. Yep, that's fine. Yeah. There we go. We're going to do the same thing over here. I know, it's a very strange feeling, isn't it? Oh, it's okay. Yeah. All right, same thing here. There we go. We're going to end up with pink hair. Out of your hair.
Yeah, I have it.
Okay. And Dorothy, hold that for just a second. There we go. Are you all talking? No, we're trying not to. I know. There. Just gonna hold it back for just a minute, and then it'll be okay. Get you guys out of here.
I'm going to send my girlfriends up here.
Yeah, we're going to get everybody taken care of.
None of us can hear. It's a shame. And we like, what you say?
Mm-hmm.
Oh, you're getting smart.
Look at you taking pictures. Oh, my gracious.
Oh, can't believe it. Oh, what the hell happened? What the hell?
Oh, I love her. I love her.
I can't believe it.
All right, printed. I'm going to get the paperwork and we're going to get y'all out of here.
Nana, can you hear me?
No, you can say anything you want.
I'm the boss.
So when it's hard, you just gotta pull it out.
Yep. Mm-hmm.
Look like an alien.
Yep. Okay, for the mirror was there. Looks like you got bubble gum in her ear.
Yeah, it does. It looks
I can't hear what you are saying.
Okay, so we got this in here. You think with everything being on the computer that we wouldn't have this much paperwork.
I know, right? Are those the hands?
Well, these are the ones that she had tried. Yep, these are ones that we have, but we're going to get the ones that just go down in the ear.
Oh, okay. How long does that take?
It takes about 2 weeks to come in.
Okay.
And it'll probably be pretty close to that because of the holiday. So sometimes it doesn't take quite that long, but being that the holiday's this week, it probably will. Okay. Now it's hard and just take it right back out. There we go. That's what your ear looks like.
Oh, wow.
That's your ear canal.
Wow.
Mm-hmm. Yep. Oh, 48 then. Yeah. Okay. Oh, yep, that's fine. Yeah. It can just be a little bit of pressure. Yeah. Yep. There it is. Yeah. It's like rubber.
Yeah.
Mhm. There's your ear.
Wow.
Take a look at this one.
can't believe my ears are clean.
They're perfectly clean, yeah. Yeah, so that's very good.
Oh, that's what's wrong with my hair.
Oh, yeah. You're like, what is going on there? Yeah, we didn't want it to get all in the pink stuff and have pink hair. There we go. All right, so we have a couple of signatures here. This one is first that we applied for the healthy plan, the one that was denied. You'll still get something in the mail from them. So that's just for that application. And I'm going to get you copies of everything here. And it'll be set up for 48 months for the $15.95.
Okay.
And this just says within 7 to 10 days you're going to get like a welcome packet, get your card from them, and then about 2 to 3 weeks. Or when if my boys come in or whatever, then they have to make things and play with everything.
I was like, I'm going to say this, and they're going to look at me like...
Yeah. All right, so you have free batteries for the life of the hearing aids. All of your checkups, maintenance, programming, everything we do here in the office, checking your hearing, there's never any additional cost. Signatures. Now, this has the price laid out a little bit differently because we do have our 50% off of our hearing aids, which is the total cost I gave you. So the price per hearing aid, the total is here, the 50% discount. So I have you come back in about 2 weeks.
Okay.
One last thing I talked to all my patients about is we want everybody to get their hearing checked, everybody over the age of 55, or younger if they're having trouble. Everybody should get their hearing checked. So we've partnered up.
Well, all my friends are
If you want to jot down their names, anybody we can call,
name on this.
and we can use your name or we can not. We can just tell them it's part of our community outreach.
Okay.
So either way, if you have their names and then if you have their phone numbers, that's great. If you don't have phone numbers, even just the city where they live.
Okay.
We'll get you out of here in time for lunch.
Yeah, I'm doing some holiday baking.
Oh, wonderful!
And selling my wares, and making pies, and I have 2 peach cobblers and 2 sweet potato pies.
I told me I'm not allowed to be busy at 7:30. I was like, why? She said, if I tell you, I'm going to have to kill you.
Uh-oh. Somebody has something going on, yeah.
She's my best friend that married my cousin.
Oh, that's fun.
Yes. So now her mom calls me sister cousin.
Love it. That is wonderful.
Her sister thought it was great.
Oh my gosh, how fun is that?
And who else can I think of?
I really do think it is because, like, he won't even let me take my sister, like, out the house.
Oh,
I'm
yeah.
like, I'm an adult. I can go places with sisters, even though...
Yeah.
Do your kids go to William Penn?
No, they go to North Hills.
Oh.
I have North Hills.
I've just seen that sign.
Yeah.
It's closed.
Yeah, it is.
It's close to my school.
Oh, is that where you went?
Yeah.
It seems like a nice school there.
It's so nice. I love that.
Yeah, it is closed. All right, I'm going to get you a copy of this. And then we're going to see you back in about 2 weeks.
All right, sounds good.
See, and even when she took the hearing aids out, she noticed everything got really muffled. Yeah. So now you're really going to be aware of what
that
you
is
will
not
miss.
me. Yeah, I can hear him talking about
That's
me.
right, you
behind
say,
my back.
just wait, because you are not going to be able to talk about me.
That's right, I know.
Absolutely. All right, well, we're going to get your copies here, and then, like I said, we'll make an appointment for about 2 weeks.
Okay. And my turkey.
And we'll get that. We ran a live turkey, so we've got gift cards for you.
Oh,
I'm just teasing, we didn't have live turkeys.
I
I had somebody, they were like, oh, I would have taken a live one. I was like, no, we got rid of all those, but yes, we have that. Never gonna get caught up today. He was like, we want to buy F off. Well, he says, I know I'm dumb, and I did the whole thing how we did on Monday, talked about like, it's really not about the money, what's the value? And he goes, it really is about the money.
Yeah.
Like, and he goes, I want to put some money down, and then pay the rest on healthy plan. He's like, okay, I just need to get that in order first. And it's like one of those things that we just talked about, and they're like, it's really not about the money. And it is sometimes. And I said, and he goes, I just am tired. I'm not getting the money that I used to. He goes, and I'm not getting into like debt that I can't pay. And he goes, and I want to put some money down, and then put the rest on healthy plan. Like, because I went into the thing, I was like, you know, I did the whole, I'm a little confused, you know, I just want, because he was like, well, we need to go home and talk about it. And I told him, I'll cancel. That's good. He'll be good then. Oh, that's good. Yeah.
And they,
But then he came out, I don't say, he goes, sometimes, he goes, I know I need these. And he goes, I want to put in another $1,000 down. He said, but I'm going to figure out where I'm going to get that money right now. And I said, you know what? That's completely fine. I understand. I'm like,
there's nothing you can do at that point in time. There's not.
but you know what I mean? It's like,
But it's frustrating.
I sat there and I did what they told me to do.
And it just still didn't matter.
Right. Because it's not about the money. Well, for him, it actually was. But I think that's when you say that, you know that.
No, then it is.
Yeah.
Then it is.
I think we had our goal though. Good. Well, come on in. We're gonna get you all fixed up today too.
Okay. Oh, I like your boots. Those are cute.
Thank you. These are shoes.
Oh, are they?
Little shoes.
Like little ankle.
Uh-huh.
Oh, very cute.
Thank you.
Well, have a seat here for me.
I was told before I had a lot of wax in my ears.
Okay. And how long ago was that?
I don't know. That's how long ago it was.
Perfect.
But they gave me drops and everything to put in my ears, and I did that, but then
Okay.
I didn't go back.
Okay.
I was left stuck with drops in my ears.
Okay. So we'll see if
The
they
guy,
come out or if you still got wax in there.
yeah, 'cause the guy at the place where I live, he said that you guys will take it out if you see it.
We can, yeah.
Thank you.
Yeah.
Because I think I got so much wax in my ears that
It can happen.
yeah.
Now, is that what prompted you to come in today, or what are you noticing with your hearing?
I just thought it was, sometimes it's like clogged up a little bit.
Okay.
That's how I feel, like it's clogged. So
Like it's plugged
I
up.
contribute it to the wax.
Mm-hmm. Okay.
So, and
And you said it's been like that for a while?
Yeah.
All right. Now, have you ever had your hearing checked?
Yeah, but, that was a long time ago, too.
Okay. All right. Well, we will certainly,
And I didn't bring anyone for that voice recognition.
that's okay.
My daughter
We
went
can
to
do it,
work.
yeah.
I was, studying for a master's, and
Yeah.
she should be done this week, hopefully.
No problem. We can take care of that. Well, a little bit about us. Hearing Unlimited has been around since 1949, something that we're really proud to be a part of. And we have 4 locations and 8 providers now.
Okay.
Last year we helped over 100,000 people to hear better. So it's definitely make sure if you're having trouble, we find the best solution for you. I've been an audiologist about 15 years, and so if you have any questions or anything, please feel free to ask.
Okay.
All right?
Okay.
Let's go ahead and take a look in your ears.
Is that a cabinet?
That is the booth where we're going to check your hearing.
Some kind of chamber?
Yeah.
Gas
It looks much worse than what it is, I promise. Take a look here. Now this one you don't have any wax. That one's all nice and clear.
Okay.
Now, do you feel like you hear better out of one ear or the other, or do you think they're about the same?
I think I hear better out of one.
Which one?
This one.
Out the left one? Okay. Well, you don't have any wax in your ears today.
In here either?
No.
You know what?
No.
Sometimes I do like this, and if something comes out,
yeah,
something
get
hard
a little bit.
comes out. What's that?
Yeah. Well, a little bit of wax. I mean, it's come out, and there isn't anything blocking your ears now. Yeah. So the drops worked, and it's that it's harder to understand what they're saying.
Yeah.
Okay.
Yeah.
All right.
Yeah.
And have you ever had any surgery on your ears? Do you have any ringing, buzzing, or other?
I was trying to figure out where it is.
Yep.
Well, it's not where I had it, so must be in the purse. I can see it'll ring again. There it
Yeah.
is. My brother, what do you want? Hello? Billy. He's in wait.
No problem. And are you on insulin or oral meds?
Both.
Both? Okay.
That's another reason why. Oh. And see, I have a lot of stuff wrong now. I have seizures.
Okay. Okay. All right. Well, and that's okay, because we can at least see what's going on hearing-wise, and if it's impacted your hearing.
Okay.
Okay. Did you have a lot of ear infections as a child or as an adult?
No.
Okay. Do anybody else in the family that you know of have hearing loss?
I'm not mentioned.
So he might have something going on.
Yeah.
Okay.
But I think I have it too.
Okay.
Or something.
You're having more trouble with
Or
memory.
something.
Something going on. Well, let me show you what we're going to be looking at. I think it's important to understand where normal hearing is and where we can, where your hearing is.
One of my brothers, they wanted to put a drainage tube in it.
Oh, excuse me. Okay.
When he was younger.
Mhm. Yeah, very common with kids. Even some adults have to get them if they continue to have trouble with ear infections.
Wow.
But you're busy.
Yeah, these are hours behind.
Mhm.
And the reason why I came back here anyway is because I don't know their doctors up here.
Oh, okay.
And I don't want to know them.
Yeah.
Or their hospitals, so.
Yeah, it's bad here, but
It's bad here.
Chicago
In one weekend, if they had 35 murders. And on Labor Day weekend, they had like 18.
oh, mercy.
And I come home right after that.
And okay, I would come home too. Mhm.
Yeah. I got all my family here.
Oh.
He has 2 brothers up there. And then none of them smoked there.
Yeah. So here's a little bit better.
He
Yeah.
just saying because he works at the VA.
Well, it'll
I
work
don't
out.
care.
I'm sure.
He can stay there. I'm not going up there.
I love it.
He told me, he said, well, you know, when I leave, I don't go back. I don't backtrack. He said, so I guess we're done for you. We don't have to call. I said, okay. So he calls like 8 times a day.
He said, I thought we were done.
Yeah. And he'll call and he won't say hello. I said, he's listening. Let's see what he can hear in the background.
What are you doing? I'm busy.
I hang up on him.
Let me show you what we're going to be looking at today. So this is the audiogram where we're going to plot the results of the hearing test. It's set up just like a piano, from low pitches to high pitches. Everything else are more limited. Now this is one aspect of hearing that we look at. This lets us know how loud does a sound have to be to get through the outer ear, the middle ear, the inner ear, up to the hearing nerve in the brain. That's where we hear. We want to make sure everything's getting to the processing centers of the brain. Do you understand what it is that you're hearing?
Okay.
We know from a lot of studies at Johns Hopkins University, if you have a hearing loss and it goes untreated, it starts to affect your processing. Our processing that does kind of affect our overall health. So that's why if you're having trouble, we want to find the best solution for you. Okay? Come on over here. We're going to put you in the box and see what's going on today.
I'm glad I'm not,
Claustrophobic? Yeah.
especially when I have to get that test done too.
Push that button there when you hear the beeps.
Okay.
And so we'll start with your left ear then. matter which ear you're hearing in, just push the button.
Okay. I was like, is that a rumble or a beat?
Or a beat, yep. Have a seat over here. I'm gonna go grab the results.
Where?
Right there, back in the chair there. Yep.
Okay.
I'm gonna go grab the results and I'll be right back.
Okay, and I'll call my brother.
Oh, sure. Yeah?
10 minutes.
Oh,
They said 10.
they're never on time.
He went right down and tried to get me.
They're never on time.
But, she said 10 minutes. They told me to tell you 12.
Okay, well, like I said, they're never on time, even when you tell them 12.
He won't be here.
Yeah, all right, well, let me show you here. You do have a significant loss in both ears. Come in and have you repeat the words similar to what we did in the booth.
Okay.
And these in the room and see how you do as well, okay? So I'm going to read a list of words. I'm going to hold this up in front of my face because I want to know what you're hearing. Okay.
Okay, I'm almost done.
Okay, well, I mean, they said 12, so we'll try to be done by then. Oh, they are never early. In this quiet environment, but we're going to put some noise in the room and see how you do. Okay? Generally, when you have hearing loss like this, when there's other noise around, that's definitely when it's more difficult. So we're going to put some noise in the room here.
Lift.
Nope. This.
Lift.
So that was definitely more difficult.
Down at that part.
Yep. And that's really what you're noticing, where you can hear the noise. I'm going to turn that off. You can hear the noise, but this
Other day I went to my cousin's party, and everybody was making noise, but I just ignore them.
Yeah. But you don't want to have to ignore the conversation. You want to make sure that you're able to participate if you want to.
Yeah.
You know, you don't want to feel like you're missing out because you're not hearing it. All right. We want to say this goes over the ear. It's the easiest to try here in the office. We do have other styles available. But we're going to put these on. Now, first thing that you notice when you first wear hearing aids is three things. Because it's going to be hard to get anything larger down in your ear. See if I can get these in, or if we have to try a different one. We may have to try a even smaller one here. Because your ears are very, very tiny.
I thought it was wax.
No, it's just that the... There we go. Okay. Now, the first thing that you notice, again, is that you have something in your ear. Because you have something in your ear. The next thing that you're going to notice once I turn these on, and that's because your own voice is the closest thing to the hearing aids. And then the third thing that you're going to notice is just everything else is going to sound different. You're going to also notice that we're not just going to make everything louder, but we're going to make things more clear. Okay? Now, we don't want to overwhelm the hearing nerve, so we're going to turn these on at about 50% of what you need. But what I want to see is, can you understand better? All right? So I'm going to put that noise back on. And we're going to turn that up to that's at the same level. We're going to do the same thing.
Okay.
Still going to hear percent to 100%.
That's the highest one?
And that's at 100%. That's where you should be hearing. That was pretty awesome. Even with all that noise, and you're still hearing the noise because you got to come in here, right? I'm going to go out in the hallway and talk to you, okay? I'm just going to ask you some questions, and you're going to answer the questions.
Okay.
All right. What did you have for breakfast? Can you hear me clearly?
Yes.
All right, Suzette, come on out here. I want you to see where I am. How far down the hallway
I start wearing these?
Immediately.
Like right now?
Well, I can't have you go home with them today,
Okay,
but it only takes a couple days to get in, so we can get them in pretty quickly,
okay.
okay? Don't you want to hear like that all the time?
I do. Am I gonna wear these kinds?
I would definitely recommend those that go over the ear. I'm going to turn these back down because we have the small ones that go down in your ear, but your ears are very, very, very tiny. So we wouldn't be able to make them that small.
They don't look small.
Well, visible,
Okay,
okay? And just because of the shape of your ear.
okay.
And they'd actually even be a little bit smaller than the ones you have on, but let me show you here. So the only thing you see is this wire that comes down that kind of blends in, and then this piece we usually get to match your hair.
Okay.
So it blends in a little bit better,
Okay.
okay? We have a couple of other decisions to make. Now, since you're not in a lot of noisy environments, really we can use just about any hearing aid because anything's going to help in a quiet environment. It's really the difference between one hearing aid and another is really how well it's going to help with there's a lot of other noise around. You said you're not really in a lot of noisy environments, so we don't have to get anything at the real high end. Now, you get our lifetime customer service guarantee, which means you get free batteries for the life of the hearing aids. All of your appointments, everything we do here in the office, we see you on a regular basis, never any additional cost. Okay? Check your hearing once a year, readjust your prescription if it does change. Never any additional cost. Okay? Now, if you're not in a lot of those noisy environments, we have a couple of options that I think are going to be best for you. Okay? One is going to be for 2 hearing aids. Yep.
Does my insurance pay
Well,
for this?
one step down.
I'm still there, Billy. I'll call you. I'm still there, Billy.
Oh, okay.
I returned the call, but he didn't.
And then
I
he
was
didn't
on
answer.
message.
Okay. So one step down from that's going to be $25.95. Either one is going to help. It's just how well it works with other noise around.
Well, who's gonna pay for it?
That's a very good question. Yeah. So most insurance doesn't cover anything towards hearing aids. Your insurance will cover $1,000, which is better than most.
That's a
Okay.
gateway.
Yep.
Right now?
We would set that up now, but your first payment wouldn't be due till the end of next month. So you would get them next week, but you don't have to pay anything just yet. Now, we have to see if you qualify for that, okay? So
Okay.
okay? So let me give you that. Let me just have you sign here that we did apply for the payment, and then you'll get something in the mail in about a week from them as to why it didn't get approved right away. So just sign there for me, and we'll see if you want to do it over the phone. We'll go ahead and get them ordered. Okay?
That paper that I just signed is for.
That's just that we applied for the payment.
Cutting down.
Yep.
Okay.
Let me take these back off of you.
I forgot I had them on.
I know, see, you forgot about them already. All
Okay.
right, and so then
Look,
we'll have
now I'm
you,
back to non-hearing.
now you're not hearing, so,
No, here.
no, just not as clear. So what we'll do though is we'll have you put the deposit down, then we can get them ordered, and we
Okay.
can still get you hearing better.
Okay, that'll be
Okay?
fine. That will be wonderful.
Absolutely.
And thank you very much.
You're very welcome.
Which way is it?
Right out here.